Hello, hi, welcome guys to everyone attending the workshop today, which is based on using simulation to improve healthcare design. I'd also like to welcome Brittany, who is our US healthcare lead, and she will be leading today's discussion. So Brittany spent a few years working for a consulting company before joining Simulate that did focus on construction and design. She's also just arrived back from the Healthcare Design Conference in San Diego, where she would like to share some of the insights and discussions from her time there. Just a few notes on housekeeping before we start. All attendees will be in listen-only mode, so this will mean that if you do talk, we won't actually hear you. But we would like to welcome any questions that you do have by using the question panel, which will be on the right-hand side of your screen. We'll endeavour to answer all the questions that you do have at the end of the session. We'll also post these into our LinkedIn page, that's Simulate in Health. A recording will also be available of the session at www.simulatehealthcare.com. Thank you. Over to you, Brittany.
Great. Thank you, Tom. I'm really excited to speak with everybody today. The Healthcare Design Conference was a phenomenal experience, as you know, if you were able to join us this year. It's been a great learning experience for us, a great conversation with folks who are really in the trenches doing healthcare design and layout and construction and all of that. And so we just wanted to share some of the lessons learned, some of the interesting new concepts that are coming out with you all. So to do that, I'm going to give you a quick intro to what the Healthcare Design Conference is all about, who's there, what are we talking about, what are the kind of conversations that are happening, and then give you some insight in case you're not familiar. I know we do have some folks who are in the design field and some who are not, so just a quick kind of level setting around what is actually the standard for how we do design today, and kind of a little bit of a peek into the future as well. And then I want to share some of the crazy ideas that we heard at the design conference this year. There's really a lot of change happening in the industry across the board, but that has some really unique implications for the design field, the need for flexibility, the need for kind of trying to look into the future, what are our needs going to be, and so I'm going to share some of those crazy ideas that we heard with you all. And then finally, we are going to talk about where the industry is going. Is evolution enough? Can we incrementally improve, or do we need some revolutionary ideas? And the argument is going to be that we need a mix of both, right? There are some things that we can increment and really make a difference in, and then we do need to get a little bit more creative around some innovations, and so we're going to talk about some of that today, and of course how simulation fits into that. And then finally, just a reminder to save the date to join us next year at the Healthcare Design Conference if you find some of this information today to be useful. All right, all of that said, let's get started. So we're going to get started and just talk a little bit about what is the Healthcare Design Conference. The conference is sponsored and was founded by a partnership between Healthcare Design Magazine, whose logo you see there on the left, and the Center for Health Design, which is on the right, which is a professional organization that really sponsors research and is the accreditation body for evidence-based design. They host a database with all of the research. They do the accreditation for professionals who want to get certified, and really their goal is to promote better design and the continual learning across the industry. You can see down at the bottom there the hashtag #HCDCon. That was the hashtag that we were using at the conference. Definitely check it out if you have any interest in this industry, because it really was an interesting way to hear some of the different quotes, some of the different things that were being said, and get a flavor for the conversation at the conference. All of that said, what we were really focused on this year, the 2014 conference, was about better care through better design. which sounds really lofty, but really what that meant from my perspective anyway, was looking at how do we use design to facilitate patient satisfaction, good clinical outcomes, error reduction, efficiency of staff and resources, and really the whole package. How does design influence the system? Which was a really, obviously, important conversation for us to be having. So the conference itself is made up of about 4,000 attendees, so it's a pretty sizable group. And the majority of folks there are architects or people who work in an architecture firm. And they really are obviously the folks who have the biggest influence on what our designs of the future are going to look like. And so it's great to see that much engagement. I mean, 2,000 architects in one room at the same time is a pretty phenomenal showing. And I think really speaks to the importance that the industry places on this conference. The other folks there, obviously, you also have your clinicians, quite a few physicians, quite a few administrators, but often kind of clinicians who are in that administrative role, people who have taken on, who are MDs, who then take on, say, CIO, Chief Information Officer roles, or CMO, Chief Medical Officer roles, folks who are involved in that decision-making process and want to have more insight into good ways to do that. A really robust and interesting conversation group, and a really important perspective for this conference. A lot of them were also presenting as well, which is great to see. The other folks there, you have obviously your builders, the folks who want to partner with the architects to do design build kinds of projects. Quite a few exhibitors, massive exhibit hall, ranging everything from ourselves, right, which is the simulation software side, to chairs and furniture and that sort of thing, to equipment, to virtual reality companies, all sorts of technology there at this conference, which is becoming more and more important in the industry. And then finally, there's a little bit of an interior design flair as well. You have a few of those folks who are there who are really partnering with the architects to make sure that the designs that they build eventually are visually appealing to, from an interior design perspective. So artwork and paint colors and all sorts of things that, you know, frankly, I don't think about when I go into the hospital, but definitely are going to influence my experience. So a great, robust group. And the way the conference is structured, I think this year there were 14 tracks, so quite a few different areas of focus. But these are the ones that we thought were most interesting, and we spent the most time going to these sessions. I point these out because I think it really speaks to where folks are interested in taking the conversation around design. Evidence-based design research, obviously a key focus area for the health design professional organization, and really increasing in importance in the industry. A lot of folks are starting to get their certification as an evidence-based design architect or designer, and really an increased focus on how do we do research, provide measurable results that say this design is truly better than that design in terms of clinical outcomes, patient satisfaction, long-term cost, operational costs, things of that sort. Some great presentations there. The other ones, you know, optimal operations, lean methodologies, it's great to see those, and obviously those are important. But the other two that, you know, weren't there last year were the improving patient and family experience and designing for wellness. Two kind of really interesting areas for an architect to be thinking about. Not only how do I physically make this space work functionally, but how do I promote wellness? This is a new kind of conversation in a lot of ways, and it goes beyond just how do I get my surgery done quickly, effectively, safely, and into how do I design for mental health? How do I design green spaces into my facilities? How do I make sure that the air quality is not just meeting standards, but a very pleasant experience? all sorts of things that really you don't necessarily think about when you think about layout, design, but obviously an important part of the conversation as well. And that's really an evolving aspect of the industry. So, we conducted this survey at the conference, but I'm also interested to hear your perspectives as well and kind of compare the group that we have on the call today to the folks that we met at the conference. Obviously a little bit different of an audience, and so we were going to launch a short poll, and I'm going to ask Hazel to go ahead and launch that. And the first question is, do you consider process flow when developing layouts? So if you are involved in doing layout design, or if you work with architects, do you consider process flow? Do you consider process efficiency? Do you use any sort of constructs for that? So we're just going to give you a minute to answer that question. If it's not something that you're involved with, then you can feel free to hold on answering the question. So we found at the conference, just while you're answering, that a lot of folks did consider process. How they considered it varied quite a bit, but it was a common yes to this particular question. So Hazel, if we can just pull up the results. Great. So it's great to see that the vast majority of you do actually consider process when looking at layouts. I would be interested later to hear from some of the folks who say, no, we don't consider layout. Why not? So perhaps if you have some thoughts about that, put them into the chat panel, because I'd be really interested to hear what your thoughts are about why process doesn't factor into your design. So we can maybe have that conversation in the questions time. So the second question there, do you use lean principles when designing a healthcare space? Obviously, Lean, Six Sigma, you can call it something else, but the question really at its core is, do you think about efficiency? So not just process, right, where my handoff's going to happen, but how do I do them effectively? How do I do them efficiently? Is an important kind of aspect to think about when you do design space. So just give you a minute to answer that question as well. We found kind of a mixed answer on this question when we asked at the conference. Increasingly, folks are talking about lean, but it's a relatively new phenomenon in the healthcare design industry, particularly for architects who weren't necessarily trained in it. So Hazel, if we can just see the results, let's find out what our group is doing here. So kind of a mix. Interesting. Okay. So like I said, Lean is definitely growing in popularity as a tool for architects to use. We did see some organizations that have actually hired in like Lean consultants, essentially, to come in and look at processes during the design phase and kind of writing the requirements phase. So that is interesting to see. And then finally, we'll ask the last question, which is, if you do use some lean principles or do look at flow, do you have a tool to help you do that, or is it just relying purely on the lean tools, right? So if you do value stream mapping, if you do process mapping, that would fall into the no, right? I mean, you're using just the lean tools. If you use something else as well, a simulator or visual, a lot of really cool kind of 3D tools that are now happening with CAD. A lot of virtual reality tools are being used. So those kinds of things, are you using those kind of innovative tools to look at your layout and the flow within it? So Hazel, if we can just look at the results there as well. Find out where people are at. Okay, so that's pretty much what we expected to see, and that's consistent with what we heard from the conference as well. And actually it's probably a little bit higher than what is being done. There's a few more yeses there than I would have expected. Which isn't really surprising given the folks that we tend to attract. I mean, you're here today, so you are familiar with simulation, or you're considering using it. You're familiar with process work of some sort, and so that isn't too surprising, but good to know. All right, Hazel, let's get back to the presentation then. That really is helpful for me as well to know kind of where people are at and what I can focus on today that will be most useful for you all. All right, so all of that said, what is happening today and how is design done in the current kind of industry standard? Before we can really have that conversation, I just do want to have a moment of level setting. What do we actually mean by design? And for today's conversation, I know it can be interpreted many ways, but for today's conversation, we're talking about the intentional decision making associated with layout and flow through the built environment. So combining both the process and the layout a little bit there, but really it's about the floor plan, the physical infrastructure that we're going to talk about. And what we heard at the conference is that there's a lot of challenges that the industry is facing in thinking about layout. So, just for a little bit of context, when we think about what are the tools that people use, we need to know what the problems are that they're trying to solve. And really, one of the biggest problems that we heard repeated over and over is that really we've only got one chance to do this right. Because renovation is expensive. Nobody wants to be 3 years into a brand new hospital and realize that they did it wrong. We really have to get this right the first time. So we've got to put the time and attention into doing it right. The challenge with that is that that's an expensive proposition. Taking the time to really invest in designing your layout correctly or most effectively for your particular organization requires a lot of time. And we all know that time is short. Money is not always available for some of the things that we want to do, and so those trade-offs are happening and people aren't necessarily getting the time to really do it right the first time. So there's a real market need there to speed up the process of doing evidence-based research, of doing mock-ups and layouts and things of that sort. We also have a lack of kind of quantifiable assessment tools. By a lot, I mean the vast majority of design that's done is all qualitative, right? Maybe we do a walkthrough, maybe we look at some pictures and say which of these, represent the vision that we're trying to achieve, but it's all very qualitative for the most part. And there's not really a good way, and a good inexpensive way anyway, to quantify this design is better than that design. The pushback to that, right, is people will say, well, that's what evidence-based design is for, which is true, but there are some concerns that are starting to percolate up around, are those conclusions actually widely applicable? So, for example, if I do a design study and I show that the ratio of 4 to 1, right, patient beds in the pre-post unit for, say, the operating room, you need 4 beds per operating room, right? And that's my evidence-based design conclusion. That's great, but is that widely applicable if I have a different patient mix, if I have more or less severe cases, if I have more or less traumas, if I have a different kind of service mix, right? I do more GI than cardio or whatever that is that 4 to 1 ratio still correct? And that is a really tough question to answer given our current tools. The other kind of issues all fall into the long-term return on investment. This is a huge financial investment to rehab a unit, to build a new hospital, to transform a clinic, to, as some of the folks were doing, take retail space and turn it into medical space. That is a really massive undertaking, and it needs to have a really long-term vision. It needs to have a really long-term return on investment, which is impossible to calculate, or nearly impossible. there's really very little feedback loop. There's very little opportunity to improve your design if you find that there's something you would want to do differently. And as the market changes pretty rapidly, we don't really know what the facility of the future needs to look like, and so we need to think about flexibility and how do we build that in. So lots of challenging conversations happening at the conference. And as a result, these are the approaches that people are taking today. Charrettes are kind of the typical get everybody in the room, have the conversation, brainstorm a lot of ideas, throw some designs up on the wall, and kind of almost a rapid improvement event style conversation. Usually that moves into some CAD renderings. This is what the building is going to look like, this is what it's going to feel like, which can then be translated into cardboard mock-ups. So this is actually a pretty typical approach. It turns out that cardboard is really expensive relative to what you'd expect, but it is a useful approach to actually build up the space, mock it out in a warehouse somewhere, and kind of walk through it and feel what the space is going to feel like, and make sure that you've caught some of the big layout challenges that might happen. And then finally, something actually really exciting, the virtual reality space for design is really starting to take off. So you can imagine, I see this picture and I think, I can imagine my chief nurse executive and my medical officer and my chief financial officer all with these little headsets on, right, walking through their new ED together and really starting to think about, is this what we want, and what is the patient experience going to look like? This is just in its infancy, but it is really promising, and talking to some of the vendors there, looks like it's going to be a really useful tool for thinking about space. And some of the design details that you don't get in the cardboard, things like, that outlet is a little bit low, can we raise it up a foot or two, can we, relay out where these buttons are, things that you're not going to get in these other formats. So that is really an innovation that's probably going to take off, I would expect, quickly. With all of that said, I think the challenge that we still have is how do we measure success? And the challenge implicit in that is we have three different perspectives, right? The patient has their desired outcomes, things like access to care, clinical quality, I don't want to have to drive very far, I want the experience to be pleasant, right? Which are very different than the staff perspective, which are different than the financial perspective. Staff are interested in efficiency, how much walking do I have to do, how many miles am I going to put on every day, is there enough space for me to be able to operate the equipment, right? Very practical, functional considerations. And then from the financial perspective, how do we make sure that we have managed the cost of operations, both of the actual built environment as well as the staffing and operational cost, efficiency, flexibility, expansion opportunity, and the organizational reputation, which is increasingly an interesting part of the conversation because there's a lot of effort into LEED certified, which has a certain perception by the community. Do you centralize or do you decentralize? How does that affect the way your system is perceived in the community? All sorts of kind of interesting questions around that. And even with the great tools that we have today, right, the charrettes, the virtual reality, how do you make sure that all three of these perspectives are considered when we're making these design decisions? I don't have any answers for you, but I think I wanted to kind of raise that as a challenge that we're working through, just so that you're aware if you ever find yourself in this kind of environment, that this is something that you do need to think about. All right. So great, Brittany, that all sounds really good. You've raised a lot of problems. So what are we going to do with that, right? That's the question you're probably asking yourself. And I think this is really where the case for change comes in. Because with all of these priorities, all of this uncertainty, we're really organizations are really looking to us as design professionals. They're looking to us as a community, as an industry, to get innovative, to really rethink the assumptions about how we do facility layout and design. And so that's what I want to talk a little bit about, is show you some of those crazy ideas that we heard that are really coming from the innovators, the people who are challenging the status quo today. All right, so let's jump into some crazy ideas. This is my favorite part. First and foremost, we have to ensure financial sustainability for our organization. And if you can permit me to simplify a little bit, the next couple of slides really talk about some of these different goals. I recognize that this is a simplification. I recognize that there's a lot of gray area here, actually. But I want to kind of give you two stark, different examples to kind of get your minds wrapped around some of these ideas. So work with me here a little bit on the simplification. When we think about ensuring financial success, the old way we did it is we sat down with our CFO and we said, how do we make sure that we're going to be financially sustainable? And he said, you know, those clinics, those outpatient surgery clinics are really profitable. Let's build another one, right? And so we did that. By doing that, we built this new clinic, right, which was a new facility that we needed to design and build and operate. By doing that, we increased our inpatient census, we improved our referral rates, we captured more of the volume in the market, right? We improved our market share, and that was great, right? That was really what we needed to do in order to be financially successful. In the new kind of way we're thinking about things, and this is the conversation that's happening now, the question is not how do we build a new clinic, but how do we decrease readmissions to the emergency room? Right? Because that actually affects our bottom line just as much as building a new clinic facility. How do we shorten inpatient length of stay as we have, as we sign contracts that are episode-based, right? So I get, let's say, $100 to treat somebody for this particular issue that they're having. I don't want them to be inpatient for 4 days if I can have them inpatient for 3 days and move them to a skilled nursing facility, right? Or I can move them to home health or support them through a different channel that's going to cost me less. Right? That's actually going to be the new model for how we're going to be financially sustainable, which means we're serving more patients with the existing infrastructure, right? So we've kind of moved from this build more, build new to rehab, reuse, repurpose. Fundamentally a different way to think about facility management and is going to have obvious implications for how we design our facilities going forward. You know, reducing wait times in the ED. These are just a couple of examples, but I think this one is really interesting because it's something that we've all been very proud of as somebody who has worked in process improvement. Right, this is the obvious thing. Right, this is where everybody always starts. It's something that we always struggle with. How do we reduce wait times in the emergency room? And in the kind of traditional mode of thinking, we say, we're going to separate out our fast-track patients. We're going to build a new facility or a new, wing, or, redesign some of our rooms so that they can be used for fast-track, and we're going to reduce length of stay. Now, that's actually been really effective and is a great thing. Don't get me wrong. But actually, I heard a physician speak from the state of Wisconsin. He is the CIO, and he is talking about how he's reusing his existing medical staff in a totally different way, right? So instead of reducing wait times by implementing a fast track, he's keeping people out of the ED altogether, right? Which is obviously going to shorten wait times for those who do end up going to the ED. And what he's done is he's actually stationed some of his medical group physicians in long-term care facilities to prevent those ED visits from happening in the first place. Okay. Totally different approach, and obviously very different facility needs. Right? On the left, we need a new ED room. On the right, we need physician offices, ease of access to patients in those long-term care facilities, new kinds of IT infrastructure, very different needs. Another example, traditionally if we've got a budget, we've got to reduce capital expenditures, what do? We just put the new facility off to next year, right? In today's environment, we are actually thinking about not necessarily delaying, right? Because that's bad for patient access, it's bad for patient satisfaction. We don't really want to do that. We're thinking about innovative new ways to use the capacity that we are going to build. This is an example that I take from actually 2 Simulate users who I spoke to a few weeks ago who are actually in the process of building this, so I'm excited to see the results. And what they are doing is they are building flexible beds that are shared between the emergency room and the operating room in order to reduce the total capacity. So what they realized is that the operating room needs a lot of beds in the morning, and the emergency room needs a lot of beds in the afternoon and into the evening. And so they've actually created a pool, and they use simulation to look at the algorithm for when do you make a trade-off, when do you give a room to the ED patient and delay the OR, or when do you give the room to the OR patient and delay the emergency room patient if you end up with a full capacity. But they have drastically reduced their total footprint, which has massive implications for the investment that they're going to make, right, and the capital expenditure that they're going to have. So we'll see how it works. I think there's a couple of organizations that have done this now, but they are really innovating in this space, and it'll be interesting to see how that all plays out. But obviously a totally different strategy to how we're going to reduce capital expenditures. 2 more examples. Patient satisfaction, kind of our traditional approach to patient satisfaction. And maybe 5 years ago, the way I would have done it, right, if I was working for a hospital, is I would say, well, let's repaint the room, right? It'll look nicer. Let's make the room a little bit bigger. Let's make the rooms from 2-patient rooms to private rooms, single-patient rooms, which has drastically increased the amount of footprint, right? The number of square feet we need to serve our inpatients, and that has been effective. But kind of the next generation approach is really taking a totally different tact and saying, let's actually, looks like our text here is just a little bit off. Let's actually take the patient and put them in control. Can we actually give the patient control over the lighting in the room, the temperature of the room, when they receive their lunch? Right? This is all going to require a heavy investment in technology as opposed to an investment in square footage. So there's a trade-off here when I think about a total budget. If I'm trying to improve patient satisfaction, do I need more square feet, or do I actually need a more interactive, more patient-centered healing environment? And the trend is obviously to the latter. Great. And then finally, just thinking about brand new facility design, my last example here, the old way has really been, well, what did we do in the past that worked well? Right? Which is an effective approach that really results in incremental improvement, but it is a method for improving your facilities over time. The new way is really to think about what does my community need, and what is the impact of my facility going to have on the health of this community. Right? This is a much more population-oriented approach. This is a much broader approach. It's going to take more time and investment, but really it's the conversation that's happening now is how do we involve our community, not just in telling us how much demand there's going to be, but in telling us what they need from our new facility. Do they need more green space? Should we incorporate a courtyard so that the community can interact with this health space? Do they need economic support? Should we, as one facility I saw is doing, should we actually build a facility where the first floor is actually retail and office space, and then our medical facility is above it? Right? Can we integrate ourselves into the community in a fundamentally different way? So those are some of the crazy ideas we heard at the conference. If you were there or if you're interested in more information, definitely check out some of the references that I have here. You can go and look up some of the content and some of the actual presenters and session information. So this will be there. If you go back to the website after this, you can see this presentation and reference this slide. So this is just here for reference. Okay, so those are some of the crazy ideas that are happening, some of which are evolution, right? Incremental approaches as new technologies come out, as new ideas come out, and some of them are really revolutionary. And, you know, the question is incremental improvement going to be enough? And I would argue that it is critical to our success to learn those things, right? To do the evidence-based design, to think about, you know, what is the right paint color? Those things are important. But we also need to be innovating at a much deeper level. So 2 quick case studies that we heard at the conference. I just want to share these with you to talk about kind of, you know, how do we innovate and what are the challenges with it. This first one was an inpatient pharmacy, and they were clearing it out and refurbishing it. And really what they wanted to do was think about patient safety. And so to reduce errors, right, they installed this automated picking system. So essentially a robot that you go in and you go to your terminal, computer terminal, and you say, I select this patient, and you know, these are the orders I want to fill, and the robot goes, retrieves the medications that you need, and drops them to you, pre-labeled and all of that kind of stuff. So really trying to reduce the human error effect, which is great, and they've implemented this layout and this new facility, and they've successfully reduced their adverse drug events, right? They've reduced their error rate, which is phenomenal. And the way they did this, and they tested this out beforehand, was actually to create physical mock-ups to ensure that they had adequate space to be able to operate all these things. The challenge was that they did these mock-ups, but they didn't really have an adequate way to test demand timing and expected queue size. And so as they've implemented this, they actually built 2 of these automated picking systems, and it has actually resulted in large queues because two terminals aren't really enough to meet demand. And they're trying to figure out, can we install a 3rd? Do we really need a 3rd? How do we do this? But they don't really have a tool for testing that kind of balance between demand and supply and what that resulting queue is going to be. The other example, cardboard is expensive. This was a message we actually heard quite a bit. This particular case, they were redesigning or actually expanding their MRI facility, and they only really had funds to do 2 of these cardboard layouts, which is great. I mean, that's better than nothing. And so what they were able to do, again with a focus on patient safety, is test 2 different zone layouts in order to prevent metal from accidentally entering the MRI area. So as you probably know, if you bring something metal into the MRI, it gets attracted to the magnet and bad things can happen. So they were looking at how do we lay out our zones in order to prevent this from happening and kind of ensure that this is impossible to happen. The challenge here was that because they only had the funds to do these 2 mock-ups, they said, well, let's take 2 designs that are very similar to what we do now, but incrementally better, we think. And so they had some other creative ideas totally out of the box, right? Totally crazy, might not work ideas. But they, because of the limited funding, they didn't want to risk that money, that time investment on something that probably wouldn't work, but might be really cool, might be really great. And so they were unable to look at some of those more creative layouts and also unable to test the process timing. So they ended up building some extra changing rooms, which ended up being unnecessary for their process. So again, capital expenditure that wasn't necessary, and the inability to test these layouts, right? Which is kind of ironic because in the effort to reduce budgetary impact up front, right, and minimize the cost of testing, they actually ended up spending more money on new space. So kind of a poor return on investment from that perspective, and some challenges there with how do you actually make this work, right? Because you don't know that doing a layout is really going to save you money. So how do you make that trade-off? So our thought, given all of that, all of those challenges and all of the conversation we've been having about how do we reduce cost, how do we make this more effective, we really believe that this is a new approach, or not even a new approach, a combined approach is really what's necessary to be most effective. So from the construction perspective, obviously we need to do a voice of the customer, gather kind of what are our core requirements, and then as people are starting to do some of that lean process design. Right? What does this need to look like? How do we make these processes more efficient? And then based on those processes, let's develop these layouts. Once we've got some ideas, let's actually simulate those with the anticipated new processes, make sure that the process fits the layout, see what those results are, potentially go back around a few times, right? This is a cyclical process. This isn't a one-way effort. And then once we've simulated that, move into the mock-up to make sure that things like the plugs are in the right place and we've got all those details figured out through that kind of virtual reality or mock-up experience, and then finalize our design decisions. Right? This is a very iterative approach. Obviously, we need an iterative kind of process, but we really think that we need to look at not lean, not simulation, not virtual reality. We really need to develop an integrated approach to this so that we can actually be successful. Because without any of these pieces, we can't really put together the full puzzle. Similarly, we talked to a lot of folks at the conference who are actually doing the lean process improvement, and so we just wanted to kind of give them a shout out as well and think about their process, which again always has to start with the voice of the customer. Right? What are we trying to accomplish? What are our needs? Move into that rapid improvement, idea generation mode, come up with the crazy ideas, simulate them, and then pilot it once we have some confidence that this is actually going to work. This is going to be really useful if I am looking at one unit and thinking about maybe splitting this nurse station from 1 into 2, or redefining some of my processes, not from a gut rehab starting from scratch perspective, but from a working with what we have, how do we make it work better for us? And this is really where we're going to have to go, right? Starting from scratch is really nice. It's really easy. Well, easy relatively. But working with the existing infrastructure, meeting the needs of more patients with the existing capacity has got to be where we're eventually going to end up. So really important kind of process to think through. Okay, so I have talked way too long, but I want to give you a brief overview of LeanHDX and how that works, because we think this is really the tool that's going to be able to enable us to do that simulation effort that kind of fits into that streamlined approach. Traditionally, simulation can take a lot of time and a lot of effort, and some of the comments we heard at the conference were that we only pull out the big guns, right, aka simulation, for the really important decisions, and we believe that that's not necessary, right? We believe that all layout should be designed with processes in mind. So I'm going to just pause really quickly here and pull up LeanHDX and show you what it looks like. Let me just refresh my screen here. Give me one moment. Okay. So you should be able to see my screen now. So LeanHDX is totally online, and I've got a couple of projects here saved. I'm just going to create a new one, and I am going to call this my doctor visit layout, right? So I've got maybe a primary care facility. Okay, I'm just going to make some notes here, and I'm going to create a new scenario, and I'm going to say, you know what, this is my base case, and I'm just going to import the default background image, right, which is just a simple layout. You can import any image that you would like. That's either a JPEG or image graphic. I'm just going to hit OK, and simulate, or LeanHDX is going to load up that layout for me. Okay, so you can see we have a scale here. I can resize this picture if I want to make sure that it fits the scale appropriately. And I'm just going to start to lay out my process. Okay, so I'm going to move my start point here to the front door, and I'm going to say, you know what, these are new patients, and I also have existing patients. Okay, so 2 types of patients that are coming in the front door. Okay, I'm just going to make sure I've got my new patients turned on. And so I'm going to drag and drop over to here. And this is going to be where people queue up. So I'm just going to make that into a queue. And then I'm going to say, well, then people would actually go into reception. And reception is actually an activity, right? That's something that people are actually going to do. I'm just going to stretch this out a little bit so it fills the space so I can kind of see what it's going to look like. Okay, and then once somebody's been at the desk, they're going to move through space. They're going to come down here to the waiting room. Okay, and then again, this is going to be a waiting area. So this is my waiting room here. And that fills up that space. Once they're done with the waiting room, they're going to come back out into the hallway, right? Once they've been called in, and they're going to go into the treatment room. And this treatment room, there's stuff happening here, so this is a task. And I'm just going to stretch this out, fill the space as well. Okay. Once they're done here, they're going to leave the room. They're going to move through my hallway here. And they're finally going to leave. And that is going to be a patient exit. Okay, and that's where people are going to leave the building. Okay, so very quickly, I've just laid out my patient flow. And I can go ahead and say, you know what, actually, I have a couple of things that happen here. But first, you know what, I'm going to create a staff room. Move that out of the way. This is actually my staff base. Right? This is where my office is. And I'm going to just add 2 types of staff here. I have a doctor. I have 2 of those. And I have a nurse. And I have 1 of those. 1 of those. Okay. And the way my staff move through space, they are actually going to move through this doorway and then come down here and then come into my room. Right, you can see how I'm going to lay this all out, build out this nice layout. Once I'm done, I actually have something of a spaghetti diagram, right? And I'm just going to quickly, for the purposes of time, open up a base case that I've already created so we can see how it looks when it's all done. Just going to take a moment to load. Okay. So once I've got this whole layout put together, I've got pink and purple lines going through here because I have 2 different types of patients, right? The new and the returning. And I'm just going to slow this down a little bit and run the model, and we are actually going to see patients moving through space. Okay, so we're going to get a feel for where's the congestion, right? Where are people running into each other? Whenever I see a couple of dots here, kind of all at the same time, that's when people are bumping into each other. I can see my staff moving back and forth, right? They're running back and forth to the office. I can see right now it's gray, which means there's nobody in there. When it's green, that means there is somebody in there, right? And I can see how things are going to move. On occasion, I'm going to see a red box here, which means that my patient is there and ready to go, but the staff are not available, right? So the patient is waiting. We can kind of get a feel for that experience. All right, so this is really great. I can get a lot of buy-in, right? People go, yep, that's kind of how my day goes. And I'm just going to speed this up, run it to the end. And I've just sped it up, so I've run through my first week, and I'm going to look at my results. And really, what we're trying to do with this tool is allow us to think about some of those questions that we can't quantify with charrettes, with cardboard, with virtual reality. Right? And those questions are, what is my staff utilization going to look like? How much time are my doctors and my nurses going to spend traveling? Right? This is a huge waste of time. This is, from the Lean perspective, this is entirely waste. And currently, there's no real way to quantify what that's going to look like, and those are really the kinds of needs that we're trying to meet here. We can also see, how many patients are in my system, how is my performance going, And we can see, you know, at times we're getting pretty busy, right? The office is pretty full. What is that, 22 patients? Even though I only have 2 rooms, right? Which means there's a lot of people sitting in the waiting room. I can also look at more specific staff results, idle time, utilization time, task results, how busy are each of these tasks, right? So reception is only about 26% utilized, right? Which means we have some more capacity. Maybe we can do something with that person. Our treatment room, very, very busy, right? So different things happening there. And then we can also look at our waiting area. And so you can see here what's going on in my waiting area 1, which is pre-reception. So not too bad there, but occasionally a line is forming. Right, we can look at a couple of those kinds of things. Okay, so that's really what LeanHDX does in a nutshell, right? Simple design, a couple of really key results that we can't get with other tools that are on the market today. So we're really excited about this actually because we think we're going to be able to really change the way healthcare design is done. So we're very excited about that. We took this to the Healthcare Design Conference, and the comments we got back were really great. People talking about, yeah, you know what, I've been looking for a need or for a way to try before I buy. You know, I am no longer an architect who designs buildings. I now design systems, processes, and this is exactly what I'm looking for. And really, this last one down here in the bottom left, there's not any more money, so we have to get creative with what we have. And this is going to allow us to do that. So really phenomenal response from the architects, the builders, the designers that we talked to. We're really excited about bringing this tool into that integrated approach that we just talked about. So if you want to join our revolution and help us redesign how healthcare layouts are thought about and done, you want to try it out for yourself, get a trial license, definitely check it out. It's www.leanhdx.com/trial, or you can just go to leanhdx.com and you'll find it there. You'll find the links. Also, please remember to save the date for next year. If you found this at all interesting, definitely consider coming to the conference next year. It's a phenomenal opportunity to network, to meet interesting people, to hear really great conversations, and really to get some ideas about how you want to innovate in your own organization. So that's going to be next November, Washington, D.C. It should be a great conference. So I have talked a lot, but we do have just a couple of minutes for questions. So I want to open it up and see what you guys have to say.
Thanks.
Tom, do you have any questions that came in?
Yeah, sure. Yeah, we do already have 3 questions actually. If you do have any more, do keep writing those, and I'll make sure we try and find time to get round to them right now. I'd just like to say thanks to you, Brittany. There, really interesting to see some of the new tools and ways of thinking used in healthcare design, and we're very excited to see how LeanHDX is going to fit in with this. Well, the first question that we have so far is, how would this tool support me if I'm doing a rapid improvement?
So rapid improvement event, okay.
Yeah.
So, if you think about the approach and what you're trying to accomplish with rapid improvement events, you're really trying to get fast results, right, and get an idea for how you're going to be able to change your process. Because this tool is so simple, right, you saw I basically built out that model in, what, 3-4 minutes. If I had taken another 10 minutes, it would have been totally done and ready to show. I think because it is so quick, even if it's not perfect, even if it doesn't capture every detail of your current state process or your future state process, you could really do this live, right? I mean, we could lay out our current state in the morning, and I could build this model out over lunch, and we could all sit down and validate it afterwards and start to experiment with how we're going to reduce queuing and all of those sorts of things. So I think there's a lot of opportunity here to integrate simulation into a typical rapid improvement event and kind of integrate it into the standard toolbox. Particularly LeanHDX, I mean, there's obviously opportunity for simulation with just the simulate package as well, but really LeanHDX is especially well built for that. And I think the other piece I'll mention, not only is it simple to use, but it also is a different perspective. Because it is layout oriented, it tends to resonate with clinicians or with staff who don't necessarily have a process background, don't have any experience with process improvement per se, but understand that, yeah, I walk from here to there, and then I go over there, and then I come back. Right? That is something that people can really relate to in a way that traditional process improvement techniques don't always resonate. So I think it's actually an opportunity for us to really engage stakeholders in a new way and hopefully faster way.
Okay, brilliant. Thanks. We've got a couple of questions here that are sort of interlinked. One is what differentiates this tool from Simulate and other simulation packages? And then along with that, we've also had a question come in saying, can it interact with Simulate? Is there a way for LeanHDX to kind of, work based on a flow that you've drawn out in Simulate?
Okay. Yeah, so these are both questions that we had at the conference a lot, actually. So increasingly, we had a lot of, actually a surprising number of architects, designers come to us and say, hey, I need a simulation package. Is this the right one for me? Which was phenomenal and really exciting to hear people really engaging with simulation as a concept and as a tool and seeing the value in it. So, that was a lot of fun, but it comes with that question, the first one you asked, which is, so why are you different? Why are you better? Why is this a unique value proposition to me, right? And I can't speak enough to the simplicity and the speed of use. Those are really the two things that differentiate this from any other tool, including Simulate. It is incredibly straightforward, right? Drag and drop, click a couple buttons. I have laid out my entire process in 2 minutes, right, live with you guys. Which is something that, even in Simulate, you can do something like that, but it's not going to have the same kind of visual interface, right? It's not going to look like a layout in 2 or 3 minutes. So there's an incredible strength there. So if you're an existing Simulate user, the trade-off that you're making for that really simple interface, the really great speed, the visual engagement, is that it is not nearly as flexible in terms of the kinds of problems that you solve, right? This LeanHDX is about layout. It is about process and layout. That is the question you're going to solve with it. It's going to look at travel time, utilization, queuing time. That is like its package, right? That is its value add. It is not going to be used for supply chain. It is not intended to be a replacement for Simulate. It is really meeting a different kind of need. And so, does it directly interact with Simulate? Not directly. Probably what I would do is, if I was in like a rapid improvement environment, I would use LeanHDX to get everybody engaged and develop some key concepts and use it as a brainstorming tool. And then if I had a need to really get into some crazy supply chain complicated logic, right, I might go back to Simulate and use that tool. So it kind of serves a different purpose, and you wouldn't necessarily want to copy-paste from one into the other, right? They're kind of two very different platforms, very different approaches to answering different kinds of questions. So I hope that answers the question. Different tools, different intended purposes, and not necessarily directly interacting, but kind of I would think about them being used in series if needed.
Okay, thank you. And then we're short on time, so we will get back to, there are another couple of questions that we will make sure to answer afterwards, but there's just been one question that's came in that I think we'll be able to answer quite quickly. We said it's a web product. Does that mean I can use it on, say, an iPad or like an iPhone or something like that?
Yes, absolutely. Actually, we demoed the product at the Healthcare Design Conference entirely on iPads. And it was actually quite fun. You hand somebody an iPad, they pick up the stylus and they start clicking without any training, without any experience, without any background. People were building simulations on their own. So it is exactly intended for that environment. Okay, brilliant. So we do have another couple of questions, but we'll make sure to answer those on social media. I just want to reiterate my thanks to you there, Brittany. That's been great. And of course, if there are any further follow-up questions that anybody has, please don't hesitate to get in touch. Thank you.